Good morning, everybody. I know this is a lot earlier of a live time than what we usually do in the group, but I have some patients today and then I need to get home to my little ones. So good morning. I hope everybody is having a very fun holiday season, a healthy holiday season. I know we're in full prep for Christmas in the Anspaugh household, so I hope this finds you all well. Now, I am going to be talking about dry needling. Let's talk about the elephant in the room. I know this has been a very anticipated live, so we're going to talk a little bit about what dry needling is, what it looks like, and then how Jen and I plan to roll basically this new treatment out to the office. Okay, so stay with me here. If you can't catch the live this morning, then there, as always, will be a replay. So dry needling is something that you've probably heard of before, maybe have or have not had it though, or maybe you've had acupuncture and you are wondering, how is this different? How is it the same? So we're gonna talk about that first, and then we're gonna cover some other, frequently asked questions. So it does differ. It is a very different technique from acupuncture. An acupuncturist can do dry needling, but a physical therapist cannot do acupuncture. So acupuncture bases itself off of meridian lines. These are lines that have been traditionally brought forth by Chinese medicine, and they are attached to different organ systems. So if you go in for acupuncture, say with digestive issues, they may not always be, actually putting needles near the digestive tract. They're going to put them along the meridian lines that may be in your hand, that may be in your ankle or your foot. And the thought is that that will affect your digestive system. Now, dry needling is going directly to the affected tissue or at a nearby tissue that can refer to the area that you're having pain. So they obviously both involve needles. That's a similarity there. They do require somebody who's certified in the techniques, a healthcare professional or an acupuncturist. But fear not. We studied with Dr. Scott Dixon, who is certainly an expert in his field. And I'm going to talk about one of the first, other than is it the same as acupuncture, one of the first questions we've gotten a lot of this past week is, are you certified now? So I do want to clarify, Jen and I took the foundational course, which is dry needling 1. We are certified to do those techniques, but to say that we're completely certified in dry needling, we'll have to take a second course next year. So we are certified for dry needling 1. Again, that covers a lot of body areas, but not all the areas. So we will be certified, formally certified, officially certified after we take the second course. So another question that we've been getting a lot of is, can you dry needle kids? Absolutely. The kids have to be able to sit for the procedure. They have to be able to sit for the technique, but we also are requiring that a parent be present because that's important, right? We need you guys to be the ones to give the consent and sign the waiver forms, especially if they're under the age of 18. But yes, kids actually do notoriously pretty well with the technique. And then we don't really have an age cap either. So we do see older individuals, or can see older individuals for dry needling as well. So those are a few of the questions we've gotten this past week. Another one, and this one is probably more involved, is what does dry needling do? So let's talk about that for a second. Dry needling is the introduction of a needle into, again, dysfunctional tissue or neighboring tissue that has a referral pattern to the area where you're having pain. So obviously it's going into the skin, into the fascia, into the muscle, sometimes the tendon where it meets at the bone, sometimes where the muscle turns into tendon. There's a bunch of different areas that we can address. But the principle behind dry needling, the reason that it works is that it disrupts those tissues, those dysfunctional tissues, the painful tissues. It disrupts them by working to induce the body's own natural inflammatory response. And if you've been a patient of mine, you know that I've talked about blood flow, you know that I've talked about inflammatory responses, and you know that I've talked about how important those are for healing, right? Because obviously when you get your inflammatory response, your body flushes blood to the area and it does what we call perfusion. Perfusion is the rate at which a body part is getting blood. So when dry needling is introduced, the needle goes into the dysfunctional tissue or nearby tissue. It causes a disruption in the muscle, tendon, fascia, and then blood perfuses to the area, which brings about all of those cells that are going to help eat away maybe some dead tissue, some knotted tissue, dysfunctional tissue, but also the cells that are going to help you build new healthy tissue. So we can use needles to diagnose spots of dysfunction. They can be diagnostic for tissue. Okay, I wanna make that very clear. They can be diagnostic for tissue, meaning we can find areas with needles that are dysfunctional, but they are also a treatment. So let's talk a little bit about what this is going to look like at Fit for Life, because the other question that I've gotten a lot, and I'm sure Jen has as well, is what is this going to look like? Is it going to change the therapy model? Is it going to be very different between you or Jen or vice versa? So Jen and I obviously train together, which means we have the same techniques. Obviously we're two different people, but the techniques will be the same. And we really want the feel of the office to be the same too. So just know that even though it may not be hands-on at portions of the treatment, it is largely a hands-on treatment technique. I mean, we're going to be with you every step of the way, and we still have to have our hands on, to get the needles in and to begin the treatment. But there is a period where we do, hands off and the needles stay in. That's called dosing. And we do that for you to allow those tissues to heal, but we'll still be around. We'll still chat with you. So right now, what we are looking to do is basically introduce the technique as an existing portion of your plan of care. So if you've been a past patient, if you're a current patient, what that will mean is that if you're appropriate for dry needling, meaning, you have a body area that we can dry needle, you have maybe had treatment with us already that has not gotten to, that was a weird little bubble. I wonder if you guys are going to see that. You've had treatment with us that has not gotten you feeling, quite 100%, or you have had dry needling before, then you're definitely appropriate for the technique, but it's going to be included in that 1 hour session that you already have. Eventually, it will be a package on its own or an appointment on its own, but for right now, the way we're going to do it is for patients who are appropriate to do it just during their normal appointments. So other than that, obviously there are waivers to sign. The day that you start dry needling, we're going to want to be making sure we're going over everything with you, which involves trigger points, the body area. We're going to take a look at the nerves that surround it, arteries, veins, make sure we get any of your questions answered before we start. It's important to note that if you are somebody getting dry needling, we ask that you come prepared to change your clothes, so shorts, tank tops, because we have to be able to get to the body part that we need to address. And then for 24 to 48 hours after, we have to keep your activity levels to a minimum. So you'll see changes to some of your exercises that you're asked to do, as well as ice and NSAID use. But I know this is a lot of information. I do have a patient coming in, so I'm going to wrap up with you guys. But please, if you have other questions, put them in the comments and we'll be happy to answer them. Have a good weekend.